Bismillahir-Rahmanir-Rahim. We will continue with maternal and child health. Assessment of child health status. Under 5 mortality. Probability of dying between birth and exactly 5 years of age expressed for 1 year time period. This is one important indicator of child health. It will give us idea about the mortality of under 5 children with different causes. Infant mortality rate, IMR. Infants, of course, refer to the age of 0 and 1 year, 364 days, did not complete the last day of the year. Probability of dying between birth and exactly 1 year of age expressed for 1 year time period. Infant and under 5 mortality are very sensitive indicators of any country's development and efficiency of health system. What are the factors related to these two indicators? Of course, as the same with maternal mortality, socioeconomic status. Sometimes you will see, or in many times, or most cases in developing countries, there will be pockets or areas where socioeconomic status is really bad. Poverty, nutrition, household conditions, and so on. Regarding the whole family, the mother, also the marital status, the age, the education, infant birth order in the family. In 2002, the infant mortality rate in Jordan was 22 per 1,000 live birth as a national level, but at the same time, some villages or areas was at that time maybe still suffering from a lot of deficiencies in health provision and low socioeconomic status. For example, Deir Allah in Jordan Valley, Wadi Jordan, Deir Allah at that time scored 57 deaths per 1,000 live birth, discrepancy from the national level. Also, it depends a lot on prenatal care. Infant mortality rates, it's really directly related to adequate prenatal care or inadequate prenatal care. It's directly related also to low birth weight, preterm birth. In fact, 66% or maybe 70 to 80% of infant mortalities are due to low birth weight and preterm birth. Other factors: birth spacing, mother's infections during pregnancy, poor weight gain, the mother during pregnancy also. Healthcare systems and insurance status also related. How we measure it? Infant mortality rate equals probability of dying between birth and exactly 1 year of age expressed per 1,000 live birth. Then it is the number of infant deaths divided by live births for 1 year time period. For neonates, causes internationally: congenital anomalies, respiratory distress syndrome, asphyxia, low birth weight. These are the neonatal problems. For post-neonates, causes of infant death: sudden infant death syndrome, SIDS, infections, congenital anomalies, and injuries. In Jordan, infant number of live birth less than 2,500 grams. This is for the birth weight, low birth weight. We are talking now about the birth weight. In Jordan, low birth weight is around 10%, and it is steady. it is the same since 2002. Low birth weight responsible for more than 50, as we said, but with the preterm it goes to around 60 to 80% responsible for the infant death. What are the risk factors for low birth weight? Yeah, they are almost the same, common with all these morbidities and mortalities, socioeconomic status, but sometimes we will identify additional factors such as maternal height, pre-pregnancy weight, maternal birth weight, cigarette smoking, alcohol consumption, history of prior low birth weight infants, infant sex, racial origin, parity, poor gestation weight gain. Prematurity, preterm birth, attributed to infant mortality as well. Preterm delivery is the delivery before the 37th gestational 8 week, so it might be appropriate for gestational age, AGA, small for gestational age, and large for gestational age. Interventions to reduce infant mortality: initiation of adequate prenatal care early and adequate, which is related to early and adequate number of visits. Identifying high-risk pregnant or pregnancy complications, infant mortality, and low birth weight. Health education during pregnancy, reducing low birth weight, preterm birth, identify high-risk population, such as the one we talked about, Deir Allah and other poor villages or areas, and improving the healthcare system, insurance, expenditure, planning, management, and so on. Interventions also need to monitor the health indicators for trends at the before 20 years, 10 years, now, and so on. Implementing better case management of infant diseases, integrating approaches to deal with major causes of death, improving nutritional status of mothers and infants in the postpartum period, promoting exclusive breastfeeding in the first 6 months of infant's life. Infections. Bacterial infections include the acute respiratory infections, which is the leading cause of childhood morbidity and mortality. In Jordan, we still suffer from higher percent of acute respiratory infections, which varies by age also. For mothers who smoke, reported higher prevalence of ARIs symptoms among children under 5 years of age compared with mothers who do not smoke. The prevalence of fever varies by age of child. Fever. Children aged 6 to 11 and 12 to 23 months more commonly sick with fever than other children. There are no significant variations in the prevalence of fever by the sex and of the child or by place of residence, and so on. Bacterial infection, also diarrhea, prevalence of diarrhea has been selected for investigation for 2 reasons. Diarrhea. Dehydration from diarrhea is a major cause of death in infancy and childhood, and the condition can be easily treated by oral dehydration therapy solution, which makes diarrhea and its management a high priority for health programs. The occurrence of diarrhea varies by age also. Episodes of diarrhea are more common among rural children. Drinking water that comes from tanker truck more likely to have diarrhea. Dietary, anthropometric, and hematological evaluation can give us some idea about the nutritional status of children. Anthropometry, it looks at the weight, height, and other indicators to evaluate the nutritional status among children. Growth indices also, height, weight, and age, are interpreted into the height for age, weight for age, and weight for height. For example, and we use the Z-score to make universal assessment for all children in the world. It means that we use the median as the 0, which is the standard, and we say if we have plus 1 standard deviation or 2 plus 2 the standard deviation, it is normal. But if we have minus 1 standard deviation, it is mild, very mild. But minus 2 standard deviation, it is more, it's not severe, but it is moderate. And minus 3 standard deviation from the median, it will go with severe malnutrition or something like that. So we look also at the percentiles for the growth and monitoring for children, 5th percentile, and between the 5th percentile and 95th percentile, and so on. Stunting in Jordan, 8.5 in 2002. This is known as growth retardation. It is height for age. Height for age. Growth retardation, indicator of the long-term nutritional status. Stunting. It can result from poor nutrition, increased number of infections, or both. At the community level, it reflects poor socioeconomic and health conditions. It is defined as proportion of preschool children under 5 years of age below -2 standard deviations as from the median, and severe stunting prevalence, proportion of preschool children under 5 years of age below -3 standard deviation from the WHO and CHS reference population. Underweight, weight for age. It is the proportion of preschool children below -2 standard deviation and severe underweight prevalence. Proportion of preschool children under 5 below -3 standard deviation from median, which is severe. Wasting prevalence from Jordan 2%, 2002. It is associated with acute malnutrition, insufficient food supply, current infectious disease, especially there. It is defined as the proportion of preschool children below -2 standard deviation or below -3 standard deviation from the median weight or height. Also, we look at anemia, breastfeeding, vitamin A deficiency, and so on. Thank you.